The most dangerous words a senior can hear are not, "you have cancer." They are, "you need surgery." And I'll tell you exactly why in the next 60 seconds. Last year, over 800,000 seniors underwent operations they may never have needed, not because their doctors were evil, not because the hospitals were corrupt, but because of a system that rewards cutting first and asking questions second. I have sat across from patients, good, intelligent people, who handed over their bodies based on a 12-minute conversation and a form they barely had time to read. Today, I'm going to give you what they never got: the 5 warning signs that the surgery being recommended to you may not be in your best interest. Not your surgeon's opinion, the science. My name is Dr. James. I've spent 21 years in clinical medicine, and I've reviewed thousands of surgical recommendations, including many that should never have been made. What I'm about to share is not anti-medicine. I believe in surgery. Surgery saves lives every single day. But surgery recommended for the wrong reasons, on the wrong patient, at the wrong time, that is one of the most preventable tragedies in modern healthcare. And seniors are disproportionately on the receiving end of it. Let's talk about why. Before we get into the 5 signs, I want you to understand something most patients never realize. Surgeons are not paid to watch you get better. They are paid to operate. That is not a character flaw. That is how the system is built. And once you understand that, everything I'm about to tell you will make complete sense. Your diagnosis is based entirely on imaging, with no matching symptoms. Here is something that will shock you. Studies show that over 90% of adults over 60 have abnormalities visible on MRI scans of their spine. Disc bulges, narrowing, degeneration, and the majority of those people feel completely fine. Now, here's where it gets dangerous. You go in for back pain, they do an MRI. They see a bulging disc, and suddenly the recommendation is surgery. But here's the question nobody asks. Was that disc causing your pain, or was it simply there, a normal sign of aging that showed up on the scan? This is called incidental imaging findings, and it drives an enormous number of unnecessary surgical recommendations every year. A 2019 study published in the New England Journal of Medicine found that in patients with degenerative spine findings, surgery provided no statistically significant advantage over physical therapy in the majority of cases. No advantage. But the surgery came with a 40% complication rate in patients over 65. What should you do? Ask your surgeon one direct question. Would my symptoms exist if you never saw that scan? If they hesitate, that hesitation is your answer. Write that question down. We'll come back to questions like this at the end. You were never offered a non-surgical alternative first. In responsible medicine, surgery is the last resort, not the first conversation. If a surgeon recommends an operation without first discussing physical therapy, medication management, injections, or watchful waiting, that is a red flag, a significant one. Let me tell you about a patient I'll call Margaret, 74 years old. Knee pain for 8 months. Her orthopedic surgeon recommended a full knee replacement within 15 minutes of her first appointment. No trial of physical therapy, no anti-inflammatory protocol, no discussion of joint injections. She came to me for a second opinion. We put her on a 12-week prehabilitation program, targeted physical therapy, weight reduction support, and a cortisone injection. 12 weeks later, she told me her pain had reduced by 70%. She never needed that surgery. The American Academy of Orthopedic Surgeons' own guidelines state that conservative management should be exhausted before surgical intervention for most elective joint conditions. Their own guidelines. And yet the conversation is often skipped entirely. The sign to watch for: if surgery was recommended at your first or second appointment and alternatives were never seriously discussed, get a second opinion immediately. We're halfway through the 5 signs. Sign number 4 is the one that surprises people most, because it sounds like good news when your surgeon says it. Stay with me. The surgery is described as routine or simple. I want you to tattoo this onto your memory. There is no such thing as routine surgery in a body over 70. When a surgeon calls a procedure routine, what they mean is it is routine for them. They do it 3 times a week. They could do it in their sleep. But that word, routine, travels from their brain into your brain and becomes something dangerous. It becomes, this is not a big deal. It is always a big deal. Here's why. General anesthesia in patients over 65 carries a risk of post-operative cognitive dysfunction, temporary or sometimes lasting confusion, memory problems, and personality changes in up to 40% of cases. 40%. And most patients are never told this before they sign the consent form. Routine gallbladder removal, routine hernia repair, routine knee scope. Each one requires general anesthesia. Each one puts an aging cardiovascular system, aging kidneys, and an aging brain under serious physiological stress. I am not telling you to refuse these procedures. Some of them are absolutely necessary. I am telling you to retire the word routine from your surgical vocabulary and ask your surgeon, what is my specific risk profile for complications, given my age and current health conditions? Not the average patient. You. Your surgeon is unusually confident and unusually fast. This one sounds backwards. Isn't confidence what you want in a surgeon? Yes, but there is a difference between earned confidence and dangerous certainty, and the difference shows up in how much time they spend with you. Research from the Journal of the American Medical Association found that the average surgical consultation lasts between 8 and 12 minutes. 8 minutes. That is not enough time to understand a patient's full medical history, their medications, their frailty status, their home situation, or their personal values around quality of life. And here is the uncomfortable truth. Some surgeons, not all, not most, but some, move quickly because speed serves the schedule, because the operating room is booked, because the system incentivizes procedures over conversations. A surgeon who is genuinely serving your best interest will slow down when you ask hard questions. They will welcome the second opinion. They will say, let me look at your full picture before we decide. A surgeon who is uncomfortable with your questions, who sighs, who redirects, who makes you feel like you're being difficult for asking, that discomfort is data. You are not being difficult. You are being responsible. And any surgeon worth their credentials will respect that. I want to tell you about a conversation I had early in my career that I've never forgotten. A senior colleague pulled me aside after a case and said something I didn't fully understand until years later. He said, "The best surgeons I know operate less than you'd expect." I've thought about that almost every week since. Nobody has assessed your frailty, only your disease. This is the most medically important sign on this entire list, and it is the one most often ignored. Frailty is a clinical term. It means the body's physiological reserve. Its ability to absorb stress and recover has dropped below a critical threshold. Roughly 40% of people over 75 are clinically frail, and frailty is one of the strongest predictors of surgical complications, prolonged recovery, and mortality that medicine has ever identified. But here is what most patients don't know. Frailty assessment is not standard practice before elective surgery in most hospitals. Your cardiologist clears your heart. Your primary care doctor signs off on your blood work, and nobody asks, can this person's entire system handle 6 hours of anesthesia, blood loss, and a 2-week recovery in a hospital bed? A legitimate pre-surgical workup for a patient over 70 should include a frailty assessment. It should include a cognitive baseline. It should include a review of every medication you are taking and how it interacts with anesthetic agents. If your surgical workup consisted of blood tests and an EKG and nothing more, if nobody asked you about your walking speed, your grip strength, your ability to perform daily activities without fatigue, your frailty was never assessed. And that gap in evaluation is a serious warning sign that your surgical team may not have the complete picture they need to make this recommendation safely. Now, I've given you 5 warning signs, and I want to be very clear about what to do with them, because information without direction is just fear, and fear is the last thing I want you walking away with. If you recognized one or more of these signs in a surgical recommendation you've received, here is your action plan. 3 steps. Step 1, do not cancel your surgery. Not yet. Do not make any decision based on one video, including this one. What you do is slow down. Step 2, write down these 4 questions and bring them to your next appointment. What happens specifically to my health if I delay this surgery by 60 days? What non-surgical alternatives have been tried or considered for my specific case? What is your personal complication rate for this procedure in patients over 70? Has my frailty status been formally assessed as part of this recommendation? Step 3, get a second opinion. Not from a surgeon at the same practice. from an independent specialist. Every responsible surgeon in the world supports this. If yours doesn't, that is the loudest warning sign of all. You have the right to take time. You have the right to ask hard questions. You have the right to walk out of that office and think. Surgery will almost always still be available next week. Your health, your cognition, your independence, those are worth protecting with every tool available to you.
Let me leave you with this.
A surgical recommendation is not a verdict. It is an opinion, a professional, well-intentioned opinion from someone who has been trained to solve problems with a scalpel. But you are not a problem to be solved. You are a person with a history, a life, a set of values about what matters to you. The surgeon holds the scalpel, you hold the choice. And that choice, made with full information, clear eyes, and every question answered, is more powerful than any operation ever performed. If this video helped you think more clearly about a decision you or someone you love is facing right now, share it. That one share could be the most important thing you do today. Drop your question in the comments. What would you most want to ask your surgeon before agreeing to an operation? I read every single one. Take care of yourselves, stay informed, and never, ever let anyone rush you into a decision about your own body.